Let's talk about penis size, because for something that gets joked about constantly, it causes a huge amount of anxiety, shame, and misinformation. And as a urologist, I can tell you this. Penis size is one of the most common concerns I hear in clinic, often from perfectly healthy men with completely normal anatomy. So today, we're going to separate facts from fiction, using actual science, not social media myths, not locker, room talk, and definitely not porn. First, what is normal? When researchers measure penis size in large, peer-reviewed studies, not self-reported but measured, the results are surprisingly consistent. Average flaccid length about 3. 5 inches 9 cm average erect length about 5. 1 to 5. 5 inches 13-14 cm average erect girth about 4. 5 to 4. 7 inches, and here's the key point, most men fall very close to this average. The distribution is narrow. Truly extreme sizes, very small or very large, are rare. If you're worried you're below normal, statistically speaking, you probably aren't. Why do so many men think they're too small? There are three big reasons. Pornography porn uses performers who are statistical outliers. That's like judging your height by NBA players. Visual illusion, looking down at your own body, makes your penis appear smaller than it looks to someone else. Cultural pressure. Society equates size with masculinity, confidence, and sexual skill, none of which are actually dependent on anatomy. This creates a perfect storm where normal becomes perceived as inadequate. Does penis size affect sexual satisfaction? Here's where science really matters. Most studies show partner satisfaction is driven far more by communication, emotional connection, arousal, and technique than by size. The vagina is most sensitive in the first 2-3 inches, not at the deepest point. Many partners report discomfort, not pleasure, with very large sizes. In other words, bigger does not equal better. What matters more? Feeling safe, feeling desired, feeling heard, and yes, knowing what your partner actually likes. What about penis enlargement products? Let me be very clear here. Pills, supplements, creams do not work. Vacuum devices. Temporary changes, only stretching devices. Minimal effects with significant commitment. Surgery. Reserved for rare medical conditions and comes with real risks. If something promises dramatic, effortless growth, it's marketing, not medicine. When size is a medical issue, there are legitimate medical conditions such as micropenis, extremely rare Peyronie's disease, hormonal disorders, buried penis due to obesity or scarring, but these are medical diagnoses, not self-judgments made after scrolling online. If someone is concerned, the right step isn't panic, it's a conversation with a qualified healthcare provider. The real takeaway: penis size is one of the least important predictors of sexual satisfaction, yet one of the biggest sources of insecurity. In that insecurity, it can affect confidence, intimacy, and mental health far more than anatomy ever could. So if there's one thing I want you to remember, it's this. Your worth, your masculinity, and your ability to be a great partner are not measured in inches. Science supports that, your partners support that, and your body, most likely, already fits well within normal. When scientists talk about penis size, they are not relying on anecdotes, online polls, or self-reported numbers, which are notoriously unreliable. Instead, the most accurate data comes from large, peer-reviewed studies where trained medical professionals physically measure participants under standardized conditions. When this is done across thousands of men from different countries, ethnicities, and age groups, a very clear and consistent pattern emerges. Most men are clustered tightly around the average. The average erect penis length repeatedly falls between about 5 and 5 inches, with average girth around 5 to 7 inches. What surprises many people is not just the average itself, but how narrow the range actually is. Extreme sizes, either very small or very large, are statistically uncommon. This matters because many men assume that average means mediocre or inadequate, when in reality it means typical, functional, and biologically sufficient. Human anatomy follows what is called a normal distribution, where most people sit near the center and fewer people exist at the extremes. Height works the same way. Most adults are not dramatically short or exceptionally tall, even though those extremes are the ones that draw attention. Penis size follows that same rule, but cultural messaging distorts perception, making men believe that the extreme is the norm. When men compare themselves to exaggerated representations, they are often comparing their average body to an outlier without realizing it. Another important detail is how size is measured. Medical studies measure from the pubic bone to the tip, often compressing the fat pad at the base to get a consistent reading. Most men, measuring themselves at home without this method, underestimate their length. Body fat, posture, and angle all influence what you see when you look down, which can create the illusion of being smaller than you actually are. This means many men who believe they are below average would measure squarely within the normal range if assessed clinically. The concern is not rooted in anatomy, but in perception. There is also a tendency for men to conflate normal with desirable, assuming that only above average size is acceptable. From a medical standpoint, normal means the body developed as expected, functions properly, and is capable of sexual activity and reproduction. The vast majority of men meet all of these criteria. Conditions that truly fall outside the normal range, such as micropenis, are rare medical diagnoses that occur in a very small fraction of the population and are usually identified early in life. They are not something that suddenly appears in adulthood because someone feels inadequate after comparison. Understanding how tightly clustered penis size actually is can be profoundly reassuring. When men stop thinking in terms of vague labels like small or big, and instead look at real numbers, it becomes clear that most bodies are far more similar than different. This similarity is not a flaw, it is how human biology works. Evolution favors function and efficiency, not extremes. The idea that most men are walking around significantly undersized simply does not hold up when examined through real data. Perhaps the most important part of this conversation is recognizing how much unnecessary distress comes from misunderstanding normal variation. Men who believe they are abnormal may experience anxiety, avoidance of intimacy, or diminished confidence, despite having entirely typical anatomy. By grounding the discussion in science, it becomes easier to replace fear with facts. Normal is not a narrow target you are likely missing. It is a broad range that includes the overwhelming majority of men, whether or not they realize it. The belief that penis size is inadequate rarely begins with biology and almost always begins with exposure. From an early age, many men absorb messages about what a penis is supposed to look like long before they ever encounter accurate medical information. One of the strongest influences is pornography, which presents a highly selective and unrealistic sample of bodies. Performers are chosen specifically because they fall at the extreme upper end of the size distribution, not because they represent the average person. When this becomes the primary visual reference point, it creates a distorted baseline, making normal anatomy seem insufficient by comparison. This is not an accident, it is a product of casting and marketing, not human norms. Beyond pornography, there is a powerful visual illusion at play. A man viewing his own body is doing so from a downward angle, with the penis partially obscured by the abdomen and thighs. This perspective shortens perceived length in the same way that looking at your own feet makes them appear smaller than they do to someone standing in front of you. Body composition further amplifies this effect. Even a modest amount of fat in the lower abdomen can conceal part of the shaft, creating the impression that the penis is shorter when, anatomically, it is not. This discrepancy between perception and reality leads many men to believe something is wrong when it is simply geometry. Cultural narratives also play a significant role. Society often links penis size to masculinity, power, sexual competence, and self-worth. Jokes, insults, and casual comments reinforce the idea that size is a defining trait of a man, even though there is no scientific basis for this belief. These messages are absorbed over time and can become internalized, especially in environments where vulnerability is discouraged. When men are taught that they should be confident and sexually capable at all times, admitting insecurity feels like failure, which prevents open conversations and reinforces silent anxiety. Misinformation on the internet further compounds the problem. Search engines and social media platforms tend to amplify sensational content because it attracts attention. Headlines that suggest men are getting smaller or that certain tricks can dramatically increase size exploit existing fears. Many of these claims rely on flawed data, self-reported measurements, or outright falsehoods, yet repeated exposure gives them a sense of legitimacy. Over time, men may come to trust online narratives more than medical evidence, especially if they have never discussed the topic with a healthcare professional. Another factor is the absence of accurate education. Most sex education programs focus on reproduction and disease prevention, not normal anatomical variation or sexual confidence. Without a factual framework, men fill in the gaps with whatever information is most readily available, which is often exaggerated or misleading. When someone has no reference for what is typical, it becomes easy to assume that being average is the same as being deficient. The result of all these influences is a widespread mismatch between reality and belief. Large studies consistently show that most men fall within a narrow, normal range of size, yet a disproportionate number believe they are below average. This disconnect has real consequences. Anxiety about size can interfere with arousal, contribute to erectile difficulties, and reduce overall sexual satisfaction. The irony is that the problem is not physical at all. It is psychological, fueled by comparison and misinformation. Understanding where these beliefs come from is an important step toward undoing them. When men recognize that their insecurity has been shaped by selective images, flawed comparisons, and cultural pressure rather than medical abnormality, it becomes possible to view their bodies more accurately. Perception is powerful, but it is not always truthful, and learning to question it can be just as important as learning the facts. One of the most persistent myths about sex is that penis size plays a central role in sexual satisfaction. Yet decades of research and clinical experience consistently show that this belief is largely unfounded. Sexual satisfaction is a complex interaction of physical sensation, emotional connection, psychological safety, communication, and arousal, and no single anatomical measurement can predict it. When people reduce pleasure to size alone, they overlook the many factors that actually shape fulfilling sexual experiences. From a physiological standpoint, the anatomy of pleasure does not support the idea that larger size leads to greater satisfaction. For vaginal intercourse, the highest concentration of nerve endings is located near the vaginal opening, particularly in the first few inches. Sensitivity decreases as depth increases, meaning that extreme length provides little additional stimulation for most partners. In fact, deeper penetration can cause discomfort or pain rather than pleasure for some people. This is one reason why many individuals report preferring average-sized partners over those at the extremes. Pleasure is not about reaching farther. It is about stimulating the areas that respond most strongly. Research on partner satisfaction repeatedly highlights communication and attentiveness as key contributors to sexual fulfillment. Partners who feel listened to, respected, and emotionally connected tend to report higher levels of satisfaction regardless of anatomy. Knowing how to read verbal and nonverbal cues, adjusting rhythm and pressure, and responding to feedback matter far more than size. A partner who is present and responsive is far more likely to create a positive experience than someone who relies on anatomy alone. Skill, curiosity, and empathy cannot be measured in inches, yet they shape sexual encounters in profound ways. Psychological factors also play a major role. Feeling desired, safe, and comfortable enhances arousal and pleasure. Anxiety, on the other hand, can significantly inhibit sexual response for both partners. When someone is preoccupied with concerns about size, performance, or comparison, they may become less attuned to their partner and less able to enjoy the moment. This can create a self-fulfilling cycle where insecurity, rather than anatomy, interferes with satisfaction. Confidence rooted in self acceptance tends to be far more attractive and impactful than any physical attribute. Studies surveying partners about their preferences often reveal a mismatch between what men think matters and what partners actually value. Many partners rank emotional intimacy, trust, and sexual technique above size. Foreplay, touch, and variety are frequently cited as more important contributors to pleasure. This aligns with what clinicians hear in practice. Dissatisfaction is rarely about size and far more often about feeling disconnected, rushed, or unheard. When these issues are addressed, satisfaction often improves regardless of physical characteristics. It is also important to recognize that sexual satisfaction is not limited to penetrative intercourse. A narrow focus on penetration reinforces the idea that size is central, when in reality, many people experience pleasure through a wide range of activities. Expanding the definition of sex allows couples to explore what feels good for them individually, rather than conforming to a single script. This flexibility reduces pressure and increases mutual enjoyment. When viewed through a scientific and relational lens, it becomes clear that penis size is a minor variable in a much larger equation. The emphasis placed on it by culture does not reflect how pleasure actually works. By shifting attention toward connection, communication, and shared experience, individuals and couples can move away from unnecessary insecurity and toward more satisfying and meaningful intimacy. The idea that bigger is automatically better when it comes to penis size is deeply ingrained in popular culture, yet it does not align with biological reality or lived sexual experience. This belief is reinforced by media portrayals and exaggerated narratives that frame size as a marker of sexual success. But when examined through science and honest reporting from partners, the assumption begins to fall apart. Larger size does not guarantee more pleasure, stronger attraction, or better sexual outcomes, and in many cases, it can introduce challenges rather than benefits. From an anatomical perspective, human bodies are designed with comfort and adaptability in mind, not extremes. Vaginal tissue is elastic, but elasticity does not mean limitless depth or width is pleasurable. For many people, excessive girth can cause stretching that leads to discomfort, irritation, or even pain, especially if arousal is incomplete or if intercourse is prolonged. Larger size often requires more time, lubrication, and careful communication to avoid discomfort. These factors are not inherently negative, but they highlight that size alone does not simplify or improve sexual experiences. Length, similarly, is often overvalued. The cervix and deeper vaginal areas are sensitive structures that, when impacted repeatedly, can produce pain rather than pleasure. Many partners report that very deep penetration is uncomfortable or something they actively try to avoid. Because most pleasurable nerve endings are concentrated closer to the vaginal opening, additional length beyond a certain point provides diminishing returns. In this context, the notion that more length equals more satisfaction does not hold up under physiological scrutiny. Another overlooked aspect is the variability of bodies and preferences. What feels good to one person may not feel good to another, and there is no universally ideal size. Some individuals may prefer smaller or average sizes because they allow for more relaxed, spontaneous intimacy without fear of discomfort. Others may find that larger sizes limit certain positions or require constant adjustment, reducing enjoyment. These experiences are rarely discussed openly, which allows the myth of universal preference for bigger size to persist unchallenged. Psychological factors further undermine the bigger is better narrative. When someone believes their size alone should guarantee sexual success, they may place less emphasis on communication, foreplay, and emotional connection. This can create a disconnect between partners and lead to dissatisfaction. Conversely, individuals who rely less on size and more on attentiveness and responsiveness often create more positive experiences. Confidence that comes from skill and connection tends to be more sustainable than confidence based solely on physical attributes. There is also a silent pressure placed on partners of larger individuals to tolerate discomfort without speaking up, out of fear of hurting feelings or reinforcing insecurities. This dynamic can prevent honest communication and reduce overall satisfaction. When size is idealized, it becomes harder to acknowledge its potential downsides, even when those downsides are real and impactful. When these factors are considered together, the assumption that bigger is inherently better becomes difficult to defend. Sexual satisfaction is not a linear equation where more size equals more pleasure. It is a nuanced interaction of comfort, arousal, communication, and mutual understanding. Recognizing that extremes are not automatically desirable allows for a more realistic and compassionate view of bodies and intimacy, one that values function and connection over exaggerated ideals. The market for penis enlargement products thrives on insecurity rather than science, and understanding why most of these products do not work requires looking at how the body actually functions. Pills, supplements, creams, pumps, and devices are often advertised with promises of dramatic, effortless growth, yet these claims are rarely supported by credible medical evidence. In clinical practice and research, there is a clear gap between what these products promise and what they can realistically deliver. Starting with pills and supplements, there is no oral medication proven to permanently increase penis size in healthy adult men. Once puberty is complete, penile tissue does not grow in response to vitamins, herbs, amino acids, or hormones sold over the counter. Many supplements rely on ingredients that may improve blood flow temporarily, which can enhance the appearance of firmness during an erection but does not change actual size. Marketing often exploits this temporary effect, framing it as growth when it is simply increased blood engorgement. In some cases, these products may even be harmful, especially if they contain unregulated or undisclosed substances. Topical creams and gels fall into a similar category. While they may create sensations such as warmth or tingling, there is no mechanism by which a substance applied to the skin can permanently increase the length or girth of erectile tissue. The skin and underlying structures act as a barrier, preventing meaningful penetration of active ingredients. Any visible change is typically short-lived and related to swelling or increased circulation, not structural growth. Despite this, persuasive testimonials and before and after images are commonly used to give the illusion of effectiveness. Vacuum erection devices are another commonly misunderstood option. These devices work by drawing blood into the penis, temporarily increasing its size and rigidity. They are medically indicated for certain conditions, such as erectile dysfunction or penile rehabilitation after surgery. However, the enlargement effect disappears once the vacuum is removed. While regular use may help some men maintain erectile tissue health, it does not lead to permanent size increase. Misinterpreting a temporary change as lasting growth is a common source of confusion. Traction or stretching devices are among the few non-surgical options, with some evidence of modest effect, but the results are often overstated. Studies suggest that consistent use over many months may result in small increases in flaccid length, typically measured in fractions of an inch. These gains require significant time commitment, daily wear, and patience, and they do not usually translate into meaningful changes in erect length or sexual satisfaction. For many men, the effort and inconvenience outweigh the limited benefit. Surgical options exist, but are often misunderstood and frequently marketed without adequate discussion of risks. Procedures aimed at increasing length typically involve cutting the suspensory ligament, which may make the penis appear longer when flaccid but does not increase erect length and can destabilize erections. Girth enhancement procedures may involve fat transfer or fillers, which carry risks such as uneven appearance, scarring, infection, and absorption over time. Surgery is generally reserved for specific medical conditions or reconstructive needs, not cosmetic dissatisfaction, because the potential complications can be significant. What unites all of these products and procedures is the way they are marketed. Fear, comparison, and shame are powerful motivators, and the enlargement industry relies heavily on them. By presenting size as a problem that needs fixing, these products create demand for solutions that science does not support. This cycle can lead men to spend large amounts of money, experience disappointment, or even harm their bodies in pursuit of a goal that was never medically necessary. Understanding the limitations and risks of enlargement products is not about dismissing concerns, but about grounding expectations in reality. When men are given accurate information, many realize that their bodies are already functioning normally and that the promised solutions were never aligned with biology in the first place. The impact of penis size on a person's life is often far smaller than the impact of how they feel about it. Confidence, self-perception, and overall health play a much greater role in sexual fulfillment and relationship satisfaction than physical measurements. When individuals believe that their worth or desirability is tied to anatomy, insecurity can quietly shape their behavior, their intimacy, and even their mental health. In many cases, it is not the body that limits connection, but the beliefs formed about that body. Confidence influences how people show up in intimate situations. Someone who feels comfortable in their own skin is more likely to communicate openly, express desire, and respond to their partner's needs. This creates an environment where both partners feel relaxed and engaged, which naturally enhances pleasure. In contrast, persistent insecurity can lead to self-consciousness, distraction, or avoidance. Worrying about appearance or performance pulls attention away from the shared experience, making intimacy feel stressful rather than enjoyable. Over time, this can erode connection far more than any physical characteristic. Mental health is closely intertwined with sexual health. Anxiety, low self-esteem, and depressive symptoms can all interfere with arousal, desire, and satisfaction. Men who fixate on penis size may experience heightened performance anxiety, which can contribute to erectile difficulties or reduced libido. These challenges are often mistakenly attributed to physical inadequacy, reinforcing the original insecurity. In reality, the underlying issue is psychological, not anatomical. Addressing mental well-being frequently leads to improvements in sexual function, even though nothing about the body itself has changed. Physical health also plays a critical role in sexual confidence and performance. Cardiovascular health, hormonal balance, sleep quality, stress levels, and overall fitness all influence sexual function. Conditions such as diabetes, high blood pressure, obesity, and smoking can impair blood flow and nerve function, directly affecting erections and stamina. Focusing narrowly on size can distract from these modifiable health factors that have a far greater impact on sexual experience. Improving general health often enhances confidence and sexual satisfaction in ways that chasing size never could. Relationships thrive on trust, communication, and emotional intimacy. Partners who feel emotionally connected are more likely to report fulfilling sexual experiences, regardless of physical attributes. When someone believes that size defines their value, they may hesitate to be vulnerable or honest, fearing judgment or rejection. This can create distance within a relationship. Conversely, when individuals feel secure in themselves, they are more willing to engage in open conversations about needs, preferences, and boundaries, which strengthens intimacy and mutual satisfaction. It is also important to recognize how cultural narratives distort priorities. Society often promotes the idea that masculinity is proven through physical traits, discouraging men from valuing emotional intelligence, empathy, and communication. These traits, however, are consistently linked to stronger relationships and better sexual experiences. Redefining confidence as self-acceptance rather than physical dominance allows for a healthier and more sustainable sense of masculinity. Ultimately, focusing on health and confidence shifts attention toward factors that are within one's control and that genuinely improve quality of life. Accepting normal anatomy, caring for physical and mental health, and building meaningful connections create a foundation for satisfying intimacy. When these elements are in place, concerns about measurements tend to fade into the background where they belong, overshadowed by the far more significant contributors to fulfillment and well-being.